A little bit about the medical care crisis that we're facing. Sometimes I'd like to think that it might be a government crisis rather than a medical care crisis, but we do have a mess in medicine, and there's a lot of talk about what's going on, not only throughout the country, but here in Washington. But first I'd like to describe how I see the problem developing and what has happened. A lot of people are arguing that free markets can't deliver medical care, which I disagree with. And the problems we face today is not a consequence of the marketplace. It's a consequence, it's a failure of the government. This idea of managed care was introduced during the Nixon years. And this was a program designed to force people into medical care and provide PPO and HMOs and tax credits for certain groups and not any others. So we have been enduring managed care over these last 35 to 40 years. And what has developed from this has been corporate medicine. The individuals who were best able to gather up the money passed out by the government or mandated by the government, they became the chief lobbyists. So the drug companies lined up, the health insurance companies lined up, the health management companies lined up, and it turned out that they started running the show and actually confused the problem and made it less efficient. So there was too much management. At the same time, too much of the money was going into these corporations, which were sort of the middlemen, and patients have suffered, the doctors have become unhappy. The main complaint I hear is that medical care costs too much. I can't afford my insurance. And there's a lot of truth to this. But one thing that most people don't talk about is, why are the costs high? Why are the costs of medical care, why are the costs higher than, say, the cost of bread or computers or television sets or whatever? And the truth is, it's a reaction to government. It's a reaction to our monetary policy. We do inflate the money supply. We do have price inflation. The prices go up more so in certain areas that the government gets involved in than in others. So the government's more involved in education and medical care, so you have more inflation there. And that is part of the problem. But over these years, there has been less competition in medicine. And that's been gradual over 100 years or so, where people couldn't enter the medical field without getting all kinds of licenses and protecting special groups. But if there's more competition and there's less insurance, actually cost goes down. So if you look at some of the procedures provided by the plastic surgeons or the eye surgeons who do keratotomies, and they're not under coverage of the insurance company, those prices actually go down. We don't have insurance for medical care. We have distorted that word. Insurance is supposed to measure risk, and you're supposed to buy that protection. So if you want medical insurance, you would be insuring against bad accidents or major surgeries or against cancer, something like that. But today, people expect prepaid services. They want every penny taken care of. They want the drugs paid for, and then that invites abuse. When third parties pay the bills, doctors, labs, and hospitals, everybody else, all of a sudden they charge the most, not the least. I experienced medicine before they had managed care, and patients were always charged the least, and nobody went without medical care. The churches and volunteer hospitals and other groups took care of the people. But now everybody has to have this so-called insurance, which doesn't do a whole lot more than boost prices and then cause shortages. And then there's a demand for what? For more government. And that's where we are today. So we're going from corporate medicine, which was deeply flawed and not working, and now the proposal here is to go to government medicine, which is socialized medicine. It's really not worked well anyplace else. People, they get care if they want to wait and watch, but today, even in spite of our shortcomings, people come to this country still for top medical care, but that will soon change if we want to equalize everything by leveling it and making sure that everybody gets poor medicine rather than extra medicine, extra and better medical care. But we could do better. What we could do is introduce the notion that patients do have rights. Anything that comes out of Washington here, which something will What we ought to fight for is the fact that we have a choice. We shouldn't be forced into a program. If the government starts a program, we ought to have the right to opt out of the program. We should be very generous with tax credits. Give tax credits for the entire amount of money you spend on medical care so that you can be independent. The concept of medical savings accounts is a good concept, and we should promote that and encourage that. And we should demand privacy. I mean, this is one of the tools that the government agents always use, and they've already set the program up. It's been passed already, where there will be essentially no medical privacy. So there's a lot of things that could be done through the tax code, the tax credit, and also protecting the individual's privacy. Now, the one other thing that we could do, we could pass legislation that would actually help along these ideas of the problem that we have with malpractice suits. What we ought to do is talk about getting rid of the antitrust laws against the doctors, where they could negotiate with their patients and get the attorneys out of the ball game, where you would agree on an arbitration board and get a tax credit for buying an insurance policy like that. So there are ways you can, through the marketplace, literally reduce this fear-mongering and excessive costs that are involved in litigation against doctors. Because right now, believe me, if you get a bump on your head, you come to the emergency room because it's a third-party payment. We're fearful as doctors of missing something due to the attorneys. Believe me, you can't walk out of the emergency room without a $10,000 or $15,000 bill, and that is not the way it should be. There are alternatives. Now, I do want to say that the Campaign for Liberty did such an exceptional job when it came to 1207 and at the grassroots level. So I suspect that the Campaign for Liberty, if they get behind some of this free market approach to medical care, they can do a tremendous job in changing the course here in Washington, because right now we're on a course towards socialized medicine, and it doesn't have to be that way. I never dreamed it would be, we'd see the results that we have seen at the grassroots level, which then affected Washington with now over 230 co-sponsors for 1207. The same thing could happen with medical care. So I would encourage all who believe in freedom and liberty, understand that medicine is no different than any other service. Freedom really works and does a much better job than coercion and just